Well, otoplasty is basically called ear pinning. It's fairly common. It depends on a person's practice, their orientation, and their specialty. It fits more into facial plastic surgery than anything else. It's a congenital problem. Children are born with this. We probably do roughly one case a month. We enjoy doing it, and patients appreciate the results. So the ear abnormalities are usually one of three possibilities. It can be the external ear, this part right here, or it can be the actual cartilage of the ear that positions it either further away from the head or closer to the head. So one is a cartilage issue. That's the ear positional thing. The other is the ear fold issue. So a person can have one of those problems. They can have both of those problems. Motivation for otoplasty is more or less psychological, to be quite honest. People are made fun of when they have big ears, and that's the bottom line. You do see people in society with big ears who grow old and they adapt and they seem to be fine with that. But many people, especially in the childhood years, developmental years, they get made fun of at school, and that's probably the biggest motivation for fixing it. During a consultation of otoplasty, I first ask the patient sometimes why, what's your motivation, what brought you to this at this point in time. What's interesting is sometimes we'll see people who are much older, and 30s, sometimes 40s, and now they decide to get their ears fixed. And you'd wonder, well, why not when you were a child? Because clearly you probably had concerns way back then. So we ask them that, what brings you to this point? The next question becomes, what bothers you? Even though I can look at the ear and say, okay, here I see these problems, it's more important to know what the patient is concerned about. They might just be concerned about the fold up here, they might be concerned about the ear being too far away from the head, or both. And so we go through that so that we match their concerns with the procedure. The surgery can be performed on all age groups. Again, there tends to be a trend towards a younger age. As children become aware of their self in school, particularly probably grade school, junior high, and there's criticism about their prominent ears, that would be the primary age group, younger, maybe as young as 5, but in the range to early teens. And then occasionally, rarely, we'll see people in their 30s or 40s. There's two primary surgeries on a prominent ear. There's what's called the Davis procedure, and I'll go through that with you. The Davis procedure addresses the excess cartilage in the ear that causes the ear to come away from the head. The conchal cartilage located inside the ear resembles a kidney bean-shaped bowl. The Davis procedure removes excess tissue from the base of this bowl. That allows the ear to be repositioned so it lies in a more normal position closer to the head. So that's the Davis procedure. And so that addresses what we call conchal bowl cartilage hypertrophy. The second issue is what's called lack of an antihelical fold. All of us should have a little crease or a fold right here, which determines where the tip of the ear sits. If there's no fold there, no antihelical fold, the ear will come out and stick out. And we're talking about the top of the ear, not the whole ear that we addressed with the Davis procedure. So this loss of antihelical fold is recreated by what's called the Mastardi procedure. The Mastardi procedure constructs a fold where there is none on the external ear. This fold is created by measuring, marking, and then stitching into place with permanent sutures to create a more natural looking fold. And it's basically done with permanent stitches that fold the top of the ear back in and create that antihelical fold. The surgery is generally not covered by insurance. And the reason for that, by way of insurance companies' logic, is that since it's not interfering with a bodily function, in other words, because you have prominent ears, that does not interfere with your ability to hear. It's a visual thing. It's just the way your ears look, not how they function. So insurance companies typically don't cover non-functional procedures, thus it's considered cosmetic, and you self-pay for that. Price range from otoplasty probably runs anywhere from $5,000 up to $8,000, depending on what part of the country you're in. The safety aspects of otoplasty are pretty good, actually. We can do these surgeries under straight local anesthesia if the patient desires. Probably 90% of the procedures we do are under what we call twilight anesthesia, where they're not awake but they're not asleep, and then we numb up the ear so there's no feeling, there's no sensation. Occasionally we'll be asked to put somebody under general anesthesia, but safety aspects in part are dictated by the type of anesthesia used. General anesthesia tends to be more dangerous, not by much, but it still is, than local anesthetic procedures. Other aspects of the surgery, as far as bleeding and infection and things that would relate to safety, are also very low. A person who's healthy is going to have a better outcome than somebody who's unhealthy. Sometimes people ask about age. They'll say, well, am I too old for the surgery? Age is a minor factor, but health is is the primary factor. Working on an unhealthy 20-year-old carries much greater risk than working on a healthy 80-year-old. So probably health risks, because the health risks, and when I say that, I mean things like diabetes, high blood pressure, obesity. Those can affect the healing process, the probability of infection, scarring, bleeding, those things. So those would be the health issues to be concerned about. So the procedure can be performed at any surgery center. We have a state licensed, nationally accredited surgical center right here, so ours is done in this facility. But it can be done at a hospital or an outpatient center as well. The length of time for an otoplasty, again, depends on what you have to do. If you have to do the Davis and the Mastardi procedure, then you're probably going to be about 2.5 to 3 hours. The other two probably cut it in half, so an hour and a half for each if they're just done separately. So pain after otoplasty is more of an achy pain, not a sharp or a deep cutting pain. Usually people see this sort of discomfort last for up to a couple weeks. After the surgery, there's basically a turban that wraps around and pushes against the ear, and that stays on for a day or so. Once that's taken off, people can use ice, and ice is a wonderful thing in terms of relieving pain, because not only does it numb the area because of the cold, but it also reduces swelling, and swelling, the more swelling you have, the more pain you have. The care after otoplasty is minimal. Mentioned that there's a turban, a wrap that comes around that pushes on the ears for a few days. When that comes off, there is ice that's applied. Everybody has some degree of bruising and swelling. That's a given. Bruising takes about 2 to 3 weeks to go away, swelling maybe 6 to 8 weeks. One of the nice things about an otoplasty is the incision is done on the back side of the ear, and we use dissolving stitches, so no one has to manage stitches. We do put most people on a prophylactic antibiotic just to be safe, but other than icing after the turban comes off, and just general activity can resume fairly soon. They can wash the areas within a day. So there's very little maintenance afterwards. Probably the most common complication would be infection or what's called a seroma or hematoma. Infection most people understand. Again, we pre-treat people with antibiotics and then they use them afterwards for about a week. A seroma is a collection of fluid below the skin. And a hematoma is a collection of blood below the skin. And if those were to develop, those would need to be drained. Usually if they're recognized, they're easy to manage and they don't pose any long-term issues. People start to get back to normal within probably 3 to 6 weeks. One of the things that dictates that question, or makes people ask that question, is when will I look normal? When could I go out and be in public and people not know that I had surgery? Well, first of all, we don't have to worry about the scar. No one's going to see the scar, so that we take that one off the concern list right away. So it really comes down to two things, and that's the bruising and the swelling. Once those go away, then a person can look really great. So again, probably 3 to 6 weeks. We typically have two pre-surgical office visits, the initial consultation where we talk about the problem, the concerns, and the treatment options. We then have another one right before the surgery. It's called a preoperative visit. We like that within a week before the actual surgical date. That allows us to cover any last minute questions and issues and make sure everybody's on the same page. Post-operatively, after the surgery, the first visit is usually a week. If everything looks good at that visit, it's then about 2 to 3 weeks for the second post-operative visit. And then if everything looks good at that visit, there's probably one more several months after that, and then we discharge the patients. The two procedures in question, the Davis and the Mastardi procedure, are considered permanent. That is 100% correct for the Davis procedure because we remove the cartilage and it never grows back. If you recall earlier, the discussion about the Mastardi, about the tip of the ear being folded out, when you recreate that fold, it's done with permanent stitches. There's about 2 to 3 stitches. If those stitches were to break for any reason, then that part of the otoplasty could fail and would need to be repeated. Typically, that would require some sort of trauma to the head to impact those stitches and cause them to break. But in a normal day-to-day situation, you could probably say the Mastardi is permanent as well. Many cosmetic surgeries, not just otoplasty, can be life-changing. And it comes back to that whole issue of the psychological impact that having an abnormal deformity of your face, it could be your nose, it could be your ears, those issues come forth early in people's lives. And it's all about people being mean and nasty about somebody who looks different. That creates a pretty big psychological scar for a lot of people. So when you fix that, it truly can be transforming in terms of their self-perception and their confidence.